Hello and welcome back to my channel. My name is Bree and this is just a quick little pop-in before tomorrow, which is this is the most awkward intro. Tomorrow is my second round of Taxol. So this will be my 6th round of chemo because I did 4 AC infusions. They were every other week for 2 every other week for 2 months, 8 weeks, and now I'm on round 2 of Taxol. So this is the round of Taxol. I did good on the first one, but this is the one where some people, about 50% of patients, if they didn't have a reaction on the first round, which was me, they might have a reaction on the second round. So I am just hoping that doesn't happen. I'm gonna think positive. I also just wanted to let you know, I actually felt pretty amazing and normal this entire time that I had my first round of Taxol, like with no side effects. The only side effect I am experiencing, and I'm gonna ask my oncologist tomorrow if it's from Taxol, which it probably is dry eyes, like so bone dry that like I've been putting the artificial tears in. I'm just blinking weird because they're so dry. I've been putting artificial tears in probably 4 to 5 times a day. They're just so dry. And it goes in waves and they get blurry because they're so dry. I wanted you to look at my eye too. So gross, but if you don't like looking at eyeballs, don't watch this part. But I also just got over COVID 2 weeks ago now. 2 weeks ago. Yes. And I've had this like lingering congestion and cough. It's all literally completely clear. Like it looks like water or clear snot coming out. So gross. But sometimes like if I laugh really hard, I get the tickle and I laugh like an old like an old car trying to start in the cold. I'm like like it's so obnoxious, but I'll start laughing and then I do that and then I just get into a full cough attack. And I think I coughed so freaking hard that I popped the blood vessel in my eye because look, this eye, let me see if this will focus. Yeah, this eye is good, right? But look at this one right here, fully blown vessels. So that's me. I look so cute right now. I'm bald with creepy like red eyes. I look like I'm stoned and I'm not. I'm definitely not. And I still sound congested even though I can breathe fine. Gotta love it. So anyway, tomorrow I have to see my oncologist first because she just wants to like hop in real quick and ask how I did last week. Then I go over to the infusion center for a quick blood draw to make sure all my levels are good. I think they check kidney, liver, white blood cell, white blood count. I don't remember what else. Probably just like your basic comprehensive panel to make sure that your levels are good for chemo. And if they're good, then I'll get my Taxol tomorrow. So I will see you in the morning. I already packed my mittens and booties for my frozen ice packs to prevent the peripheral neuropathy. So we're doing a little bit better this week so far. All right, I'll see you guys in the morning. Bye. Good morning. Forgot to record when I was home because it's really early and my daughter was also asleep pretty much the entire time I got ready, so I didn't want to wake her up. But I am on my way now to my oncologist to say, hey, hello, what's up? Here's how I feel and here's my dry eye. And then I get the blood draw to see if my levels are good enough to get chemo. And then if all is well, I will be getting chemo, which they should be all as well. But they should be well. I'm not awake yet. I also forgot to tell you guys, on Wednesdays, I can't, this is a very bumpy road, sorry. Holy cow. I can't take my allergy meds because I don't take any of my supplements or whatever on chemo day because I just don't want it to, I don't know why, I just don't. But she said to not take like Claritin or Zyrtec. I'm on Zyrtec now. But when I was on Claritin, don't take it the day of chemo because I guess it could like counteract with whatever other pre-meds I'm getting. I don't know. But I'll be getting Benadryl today and dexamethasone. So I don't really need allergy meds if I'm, oh, and Pepsid. I don't know. I just don't take it on Wednesdays. So, and yeah, if you can hear, I'm still congested from the COVID crap from 2 weeks ago. And what else did I want to tell you? Oh, my eyelids, they look weird. See how I like drew my eyeliner like a little bit away from my eyeball? I don't know if my eyelids are getting irritated from my makeup because of chemo, or option 2, my lashes might be starting to fall out soon, although it's kind of early, and maybe that's why they're irritated, but or because my eyes are so dry, maybe that's why they're irritated. But regardless, they were super like puffy this morning, so I probably shouldn't even be putting makeup on today, but I can't like go out in the world with no makeup. I just can't do it. Anyway, check back in with you when I'm in the chair, and say a prayer I don't have a reaction today, because I still have a 50% chance of that. So hopefully that doesn't happen. Okay, bye. All right, I am all hooked up. I have the Benadryl and Pepsid going in right now, and some saline. And then I'll get dexamethasone. And then I'll get Taxol. And that's it for now. Just wanted to hop in real quick, and I totally forgot to check in like on the ride home and when I got home. But I feel pretty good. Like I feel good like I did last week with my first Taxol infusion. This is my second one, so I guess I can expect to feel this way going forward, or it might build up as I go, because as you get more, it just builds up more and more in your system. So who knows? We'll see. What did I do? So I ended up coming home. I was a little tired, but I didn't like sleep. I was tired for 2 reasons. My eyes have been really dry, so my eyes just feel exhausted all day anyway, even with my tears. But I also was up at 5:45 a.m. today, which is not me at all. Normally it's like 6:37, 7:30. I just wasn't ready for that. So I then ran to the grocery store. I didn't really feel like making a big dinner, so I grabbed a rotisserie chicken and some sides and made that super easy for dinner. Then we had organic pears for dessert. That was good. And cleanup was easy, and I still have some energy, so I am going to work a little bit when my daughter goes to bed. It's like 6:30-ish almost right now, so gonna get her in bed soon and then work a little bit and probably zonk out. So I will check in with you tomorrow or the next day, or one more time or 2 more times before I close this video out. And yeah, just wanted to fill you in. Oh, my eyes. So when I was at the grocery store, I grabbed Visine. I don't have it on me right now, but the Visine redness, red eye or whatever. And I'll put a picture up right here. My blood vessel from coughing so hard the other day, and I guess I blew out a blood vessel. But anyway, it was this one, and you can still kind of see that it's like pink, but it is nowhere near as red as it was, and that Visine works. So if your eyes are red, get that one. But if they're just like dry, get the Refresh. The Refresh artificial tears. Those work great. I use those like 4 or 5 times a day, and they just like add tears to your eyes. So that's it. I'll see you in the next clip. Hello, today is the day after my second Taxol treatment, and I just wanted to check in to let you know that I feel pretty freaking fabulous. Wearing my pink wig. I decided to braid it. It's super messy because I was at the park today with my daughter for a while, and then I don't know where all this energy's coming from, but I'll take it. Yeah, I just wanted to say hey and hop in real quick and update you on day 2 after my second Taxol. I just made dinner, just ate dinner. Now I'm cleaning it up. And then have to get my little one in bed and then work a little bit. And then I get to go to bed. Yeah, so all is good over here. And I'm extremely grateful for it. I think my congestion is finally going away. My cough is still like lingering, but it's nowhere near as much as it was. Overall, it's maybe like 10 times a day instead of like a million. So that's an improvement for me. But yeah, just letting you know that so far so good. So I'm hoping this continues on my Taxol journey. I got 10 left after this one that I just had. So I have 10 more Taxol infusions to do weekly. So I know it builds up as you get more and more, but for now I'm feeling pretty super fly and I will gladly take that. It's a nice break from feeling exhausted and everything tasting disgusting from the Adriamycin cytoxin. You what? You want to say hi? Hi! She loves piano. We do have a dog named Harley. She has to tell you every time. A little dog named Harley. All right, so I will check in one more time, maybe. If I don't, then I'll close the video out in the next clip. Okay, so it is officially Saturday, 3 days since my second Taxol infusion. So the only side effects I'm experiencing is just the dry eye, and I've gotten 2 different eye drops for that, which are helping. I'm still congested, and I don't know if that's from the Taxol and like my immune system being weakened and I'm not able to fight off a stuffy nose as quickly as I used to before, or if it's leftovers from COVID. So either way, and I still have the cough, but it's not anywhere near as bad as it used to be. It's just like annoying, if anything. But that's pretty much it. I'm extremely tired right now, but I, again, don't think it's from chemo. I've been up since like before the sun, and my daughter wakes up throughout the night, so I just don't really ever get like a solid night's sleep. So I think that has a lot to do with it. Plus we were out like pretty much all day today, and I'm just like tired from being out all day, and I'm ready to just chill. So I just wanted to close this video out with the final update of my second round of Taxol. Everything seems to be going really well. I feel pretty good overall, and I feel a lot better than I did on the Adriamycin cytoxin for sure. So that's something to look forward to. But yeah, I'll keep you posted as I go. I mean, I'm pretty sure with each treatment, it's like another layer of chemicals in my body. So I'm sure, given the fact that it's weekly, by the time my body is starting to come back to normal and I get another layer of chemo chemicals going in, I don't think my body will be able to fully catch up to like the level of awesome that it felt before starting chemo. So eventually I will start to feel more and more tired, I'm assuming, because that's typically what you're supposed to expect. Hopefully not though, but we'll see. And I will keep you posted on that. So I hope you enjoyed this video. If you did, give it a thumbs up. Be sure to subscribe for updates, because I put videos out pretty much weekly now. Every week that I get a chemo treatment, I put up a video, and then once chemo is done, I'll do the surgery video and that whole fun part of my journey. And then after that is radiation, and then after that is a hormone pill. I'm pretty sure tamoxifen, I think. Don't quote me on that. So we gonna be friends for a long time. All right, I'll see you in the next one. I hope you're having a great day. Remember, smile, be happy, and put all your wins, no matter if they're small or big, put them in your win bank. Because on days where you feel like poo, you can remember your win bank and be like, oh yeah, that was a good day, or oh, that is true, I don't feel like that anymore. So that's one good thing. Even though I feel like poo today, I don't have to deal with that anymore. So trust me, win bank, smile, positivity, and I better see you in the next one. Bye.